It is very important, and the reason is because although it's not very prevalent and it's not very frequent, patients with neuropathic pain, it is known that they suffer more than other people with other types of pains. That's the first reason. The second reason is because the response to neuropathic pain to conventional analgesics like acetaminophen or anti-inflammatories is very poor. So if you don't identify neuropathic pain properly, you're not going to be treating the patient properly, and you're going to be leaving the patient with increased symptoms that they are increasing the severity of poor quality of life. This training is very easy. So there are some guidelines as per how to screen patients for the presence of neuropathic pain. And the screening is very simple. You just need a patient who can tell you about the description of their pain and a basic neurological examination. So with just a basic training, it is possible and feasible to identify neuropathic pain patients. Neuropathic pain can come from different origins, and there are different classifications of neuropathic pain. And not all neuropathic pains are the same. The matter of fact is that it seems that there are different types of neuropathic pain responding to different types of drugs. Therefore, it is important to identify what is called phenotype of different neuropathic pains in order to link them with different responses. There are, in particular, there is a type of neuropathic pain that seems to respond better to, for example, oxcarbazepine, which is an anticonvulsant. And these type of patients with this type of neuropathic pain, they present something called irritable nociceptor. So this is just an example that we're trending towards making sub-analysis and sub-classification of neuropathic pain patients according to their response. Neuropathic pain can be distinguished from others because of the particular features after a clinical interview and after a physical exam. So after a proper training, it is possible to subcategorize patients with neuropathic pain in different categories that potentially could respond differently to different types of antineuropathic medications. Yes.